dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and our topic today is about understanding sensory processing. My guest is Allison Morgan, founder and CEO of Sensational Kids, an educational company bringing evidence-based yoga and mindfulness practices to school communities worldwide, teaching the inner resources of focused attention, self-awareness, and resilience. Welcome, Allison. It's a pleasure to have you with us, and I'd like to jump in right now by asking you, what is sensory processing?
Oh, what a great question, Yvonne. I get asked this all the time. So we have everybody's familiar with our main five senses, right? Things we see, what we smell, what we taste, what we touch, what we hear. And there are some other senses that I could go into maybe, during our conversation, but sensory processing essentially is we take in all of this information, right, through those sensory systems that we just talked about, and it gets brought into our brain through our nervous system, and it's the process of our body taking it in, organizing that information, filtering out what's needed and what's not needed, and then deciding, how do I respond to that information? So sensory processing essentially is all of those things. It's the taking it in, it's the filtering out, it's the reorganizing of it, and responding appropriately. That is normal sensory processing.
And many people have experienced an overload in sensory issues. Mm-hmm. And also children experience sensitivity related to sensory issues. Can you explain what it looks like?
Sure. So when we observe that in an individual, depending on the extent to it, there is a diagnosable condition called sensory processing disorder. And it's not necessarily cut and dry of what it looks like in an individual. It could be very, very varied. So you use the word overloaded. So what an overload might look like, essentially what that would be is the sensory information is coming in, but the individual within that neurology isn't able to filter out what they don't need from the information and what they do need. So what that might appear like to that individual is they touch something and it feels like to a normal tactile system would feel like they're touching tacks. And it could be the simple thing like glue or paint, which to a normal sensory system is like, it's glue and paint. It's soft, it's cool, it's mushy. But for an individual whose sensory system is taking that information in, but their brain can't really filter all that out, it's just like bombardment on that system.
And so what do we do? What do we do about that when we notice that? How do we help, people of all ages to deal with that overload as it occurs?
Yeah, so the first thing really is to be a very good observer of what is it within the realm of that individual's safety, of them feeling safe and things being okay. So that would really be the first thing, because you initially would just want to, it's like keeping them from harm's way. You're not going to be like, okay, this is just paint and glue, like get your hands in there and you're going to get over it, because they're not just going to get over it. So in terms of therapeutically, what we would do, it's important to look at each of the sensory systems and determine which are the sensory systems that that individual is really having a hard time with. Because, and this is like the beauty and the art of occupational therapy, because we really are skilled at being able to assess where the challenges are within each of the sensory systems. And what we design is what we call the just right challenge. So you sort of, so let's use the example of somebody using, they're tactilely sensitive, right? Because they become easily overwhelmed. Because there also is that flip side of individuals that, like, we'll use again the tactile system, they can't get enough. They want to touch everything with their hands, with their body, putting it in their mouths, because their brain is not getting enough information about what it is that their skin is in contact with. So going back, though, to an individual that's overloaded, really what you want to do first is, where is that threshold? How much are they able to tolerate? And where is it like you went over the line? Because you want to stick with what is comfortable. So for a parent or in school, it could be, what toys and what textures does this child enjoy working with and playing with?
Now, Allison, if I may interject right there, it can also apply to what they wear, clothes, how it feels on their bodies, tags, and all of that. I don't want to lose sight of that, because that's important.
Absolutely.
That goes with it.
Well, we're only talking about the tactile system, right? There's a lot of other sensory systems, but tactile system is not just your hands, right? It involves all of your skin, right? From your head, encompassing all the way to your feet. It's also, you have tactile receptors in your mouth through the genital area. All of that's the same sensory system. That's one sensory system. So when I gave the example of the individual who's touching everything and putting things in their mouth, because you get tactile information by what's in your mouth as well. We have tactile receptors there as well. So again, going back to interacting and play and developing the tactile system, we need to first establish what is comfortable, what is okay for this child. And then we find out what is that just right challenge. Like, what is that little bit that we could add that's maybe a little bit outside their comfort zone, but they're willing to give it a try, so that their brain can get accustomed to the feeling of that. So you might think of something like the child is okay touching cotton balls, but is not okay touching tissue paper. This is just like a broad example. So finding other things in between that of the texture that would be okay for them to interact with. So like in a play, in a school situation, in a classroom, that's really the best place to start.
So the
what's
teacher,
comfortable?
Yes, the teacher is defining that.
Right. What's comfortable? What's not comfortable? What's in the middle? What could we introduce that's just the right amount of challenge for them? From a therapeutic standpoint, there are things that we can do to help their nervous system relax and calm, so that they're not at such a heightened stress state where they're not accepting of any challenge. So something to keep in mind is that these people that do have severe sensory sensitivities, they're constantly in a state of stress, because, like you said, it could be like just their tags. They're dealing with that tag all day, and now you're going to introduce something else, like "get me out of here" type of thing, right? So their brain is firing from a stressed state, And when that happens, they have the chemicals of cortisol and adrenaline rushing through them, which are keeping them in that sort of fight, flight, or freeze state. So therapeutically, there are some things that we can do to help relax the nervous system so that it'll be more accepting of challenge. So some things are like a bear hug. I mean, that for a parent, that's a great thing. Even for a teacher, it's so good to know, because in schools where, we're told don't touch, be careful of your touch. But sometimes kids need that big, tight bear hug, or giving them a squeeze of their shoulders, almost like a little massage. Or if they're old enough, telling them to do this themselves. And essentially what we're doing is we're applying what's called deep touch pressure. I mean, this is a therapeutic tool that we use all the time. And through that deep touch pressure, we're promoting the secretion of calming hormones, so dopamine and serotonin, to counteract some of that cortisol. And it helps the brain begin to calm down. So the system will be more accepting of a little bit more challenge.
And what
other things
I'm sorry. I was going to
I'll
ask
just give
what
you two other things.
I wanted to
Go ahead.
clarify this one thing, if I may.
Yeah.
What do you do with that tactile sensitivity if the person does not want to be touched in order to help them? I just want to give our audience an opportunity
Absolutely.
to have another tool.
Yeah. Well, I just want to comment on that, because I do hear that sometimes, well, he doesn't want anybody to touch him.
Right.
Right. But therapeutically, I know, he just needs a big, tight hug. Sometimes that's their reaction, because people are actually touching them lightly. A little light touch, which is like, it feels to them like spiders crawling up and down their spine. So it really is about the right type of touch. And here's the other thing. They need to trust you if you're going to apply that type of a tool. So sometimes we might have somebody like, I have to do this because it's the therapy for this child. So, like, come here and let me give you a hug, right? But there's no heart in it. They sense that. So you're defeating the purpose. But here's some other things that you can do with them. One is rocking. So being in a rocking chair is very calming and organizing to the nervous system. That they could do on their own in a chair, or sit in your lap and you can hold them and you can rock them. The other thing is rhythm. Listening to music, clapping, stomping your feet, clapping your body. These are all things that they could do, on their own. And it is about calming that nervous system, sort of like flipping that switch a little bit from being in a stressed state to being in a more relaxed state.
Now, Allison, those examples that you gave, they can be applied to other sensory issues like smell issues or other hearing issues or just other types of issues, correct?
Well, the things that we typically see in terms of this, hyperactivity or hypo activity. So kids that are easily overwhelmed, or those that it's like they can't get enough of that sensory information. We typically see it with three main sensory systems. So their tactile system, their proprioceptive system, and their vestibular system.
Can you explain the difference?
Yes. Okay. So we already talked a lot about your tactile system. Yes. Your proprioceptive system is your sense of body awareness. And what it is in all of our muscles, our ligaments, throughout our body, we have these little receptors called proprioceptors. They look like little coils of a pen, like the inside of a pen. And they're activated every time a muscle is stretched or it's compressed. So you think about that coil gets stretched and that coil gets depressed. So it tells us, it sends those proprioceptors throughout every muscle and ligament, send messages to our brain. Oh, your arm's out there to the side. Like, I don't need to look at my arm to know it's out there, right? Those proprioceptors are firing based on what's contracting and what's extending, and sends a message to my brain to tell me where my body is. It also helps me understand how much force to put on something, if I'm pushing or pulling, and literally like how I'm moving my whole body in space. So sometimes we have, kids in class, they're bumping into everything, they're tripping over things because they just don't have enough sense of their body or control of their body, because the information that the proprioceptors are sending to their brain, they're not getting accurate information. So that's our proprioceptive system. The other system is called our vestibular system. And our vestibular system is controlled by vestibules deep within our inner ear. And it's a canal system that's filled with fluid. It's activated every single time we move our head in any direction. It tells us which way our body is moving and how fast or how slow our body's moving. And it plays a huge role in our overall muscle tone and our sense of self. So specifically, like our vestibular and our proprioceptive and our tactile systems, they work together and really are the foundation for us feeling like safe within our own body. Because if you could just imagine for a moment of not being aware of how your body is moving, what your body is touching, and what your body's doing, it's very ungrounding, right? It would be very scary to not know. So these are three essential sensory systems, even for learning. So when we have students that have misinformation about these sensory systems, learning is so challenging because they don't have a good sense and feeling of themselves within themselves.
So what can educators as well as parents do if they're noticing any sensory processing challenges within their children?
Yeah, I mean, as I was saying earlier, the first thing really is to just be a good observer. I would almost say a compassionate observer, to understand what is comfortable for this child and what is not. Because as much as we want our children to learn and grow and discover more and explore, they need to have a sense of feeling safe, feeling understood, and feeling cared for. So they need to trust you. And if you're always pushing them, like, why won't you wear that shirt? Or why won't you go on the playground? Why won't you go on the swing? They're not going to trust themselves. They're not going to trust you. And it's going to be a whole behavioral, you'll be peeling that child off the floor a lot. So the first thing is find out what safety is for them, what they enjoy, and engage in that with them. So you're essentially an external component helping them feel safe. And once you establish that, offer a small bit of challenge rather than pushing for the whole thing. That would be my start. My next thing would be find a good professional to help you along the process, because it's not the type of thing like, oh, we're just going to do these 3 things and it's all going to be wrapped up, because you're talking about neurology that's challenged, right? So the therapeutic aspect of what you're going to do to help these children is really about rewiring a nervous system. So having a professional guide you in that really, really is essential.
And how might one find the appropriate professional to help guide them?
Well, in most states, if your child is, newborn to 3 years old and you're suspecting that there might be some issues, most states have an early intervention process that you can get linked into through your pediatrician. Once your child is 3, from 3 to 5, most school systems have a preschool process. And you can write a letter to the special services or the director of special needs within your community school and inform them that you have concerns about your child. And once that letter is received, most states, they have like 30 to 90 days to respond to you. They would send somebody out to your home to do a quick observation and see if they agree that there are some issues. And then they may then be able to provide services or help you with getting the appropriate evaluations done. And then, of course, it's seek out a local occupational therapist who can at least give you an evaluation, give you some recommendations, give you a starting point of things that you can do at home or things that you can share with a teacher, an educator that is, working with your child at school. But those would probably be the best places to start.
Okay. And as far as you mentioned a safe environment, the environment in itself, what recommendations would you give for educators in a classroom, for parents in a home, on what they can do environmentally to make children as well as adults comfortable in the place that they are in?
That's sort of a loaded question because it depends on the child. Okay, so here's the most important thing: the other people in that environment. So for a home, it's the parent. For the parent to be calm, compassionate, clear, and present. That is going to provide your child with the safest environment. You're the most important thing in that environment. And in a school, it's the teacher. So for an example, if that child is in an environment where the main adult in that environment is highly stressed, highly anxious, why won't he do this? He won't, upset. The child's just going to feel that from the adults, and that's going to make it harder for the child to feel safe in that environment. You could actually be in the most cluttered, disorganized bedroom setup, all of that. But if you have a calming, grounding adult there, that will support the child more than anything else.
And I would think that any fears that the child might have just in the nature of just being a child or change or anything else, having that in their atmosphere, an adult that is calm, be it in school, be it at home or wherever they go, will help them to feel more safe and perhaps more grounded themselves.
Yeah, absolutely. All of the children that we see that really have severe sensory processing disorders, they are greatly challenged by their inability to self-regulate. So they're very dysregulated. Their nervous system's all over the place. The easiest way to help another nervous system regulate, ground, and calm is to be that person that models that. Because our nervous systems are designed to connect. We have these mirror neurons where we're able to feel what other people are feeling around us. We feel other people's anxiety. Well, we feel their calm as well. So it's a great way to help teach and help someone else feel regulated by being that for them. So we all have experienced challenges with some sensory processing at one point or another. And I'm just going to give this example for myself, and maybe some people can relate. So when I'm driving in the car, I love listening to music, right? It's very, very calming to me. Everything feels good. Well, when my oldest daughter started to drive, when she got her permit, she's behind the wheel. I'm in the passenger seat. I'm stressed beyond belief because I'm driving a teenager's driving this car and I'm looking everywhere and I'm watching her and she wants to put on the radio. Same station I'd listen to, she puts on the radio. I could not process everything around me, what I'm feeling, and music. And I had to say, Molly, I have to turn that off because that was bombardment to me.
I appreciate you giving that example. Now, are there other issues? Because it does happen to all of us at any stage of our life,
sure,
any change, any new beginning, anything. It happens, and it comes out in ways that we might not have anticipated.
Absolutely, absolutely. I've even had the experience of, you're going on a job interview or you're going to be in what you know is going to be kind of a stressful situation. You're going to be tested in some way. So you're like on guard and you're all lit up and you've got a tag and you're wearing a brand new shirt and there's a tag on the shirt and you're getting ready and you're constantly like this. Because again, your nervous system's at kind of a heightened state. So there are certain sensory things coming in that are just like poking at you. You're noticing them more.
Because you're at a more heightened level.
Exactly.
So the key is to acknowledge it. Don't avoid it. It's when it really is taking the time to be present with oneself and realizing what is in fact triggering certain things within the body.
Absolutely. So it is awareness, number one. Number two is, if you can, take that annoying trigger out, cut out the tag, turn off the music. But then to even say to yourself, I'm experiencing this because I'm in a stressed state. What could I do to help myself? So it could be take 5 deep breaths into your belly. Just takes a few minutes. Or some self-affirming thoughts. I'm okay. I got this. With my daughter in the car, somehow she passed the permit test, so she must be ready for this. Whatever you could say to yourself.
Surely, and for children,
help you be okay.
Exactly, and for children who are just starting school or going into different situations, as you mentioned, adults starting even a new job or something, again, that breath, taking the breath and awareness, that breathing technique to just be centered and grounded and to be aware can make a difference.
Yeah, absolutely. Absolutely. Our breath is our most vital tool. It really is transformative when you know how to use it.
So it's also transformative when we realize that we all work in harmony and collaboration with each other to help us to understand what's going on within ourselves and each other, and to do what we can to make people feel comfortable and safe in our homes, in our schools, in our classrooms, and to be sensitive to take the time to be aware and to realize we can help make a situation better.
Absolutely.
Thank you for everything that you do. We greatly appreciate it. Until next time.
Thank you. Thanks, Yvonne. Bye-bye.